Good afternoon, everyone. I am Dr. Jamie Irene Galang, and in behalf of Polymed Santa Rosa Department of Pediatrics, I would like to welcome everyone again to our monthly parents webinar, Health Talks at Your Fingertips. Just a few reminders to avoid distractions during our webinar. Kindly follow these instructions. Keep your mic on mute. Turn off your video camera. If you have questions, send to us by typing in the chat box. We will answer your questions during the Q&A session. If you're watching via Facebook Live, kindly send your questions through the comments section of the video stream. Thank you, and let's enjoy the knowledge sharing today. Our topic for today is about vision screening in children. Let's now start our program with our opening prayer.
Let's place ourselves in the presence of the Lord. Dear God, we offer everything to you during this webinar. May we ask for your blessing and divine providence that the activities set for this undertaking be successful and effective. May we be living witnesses of your genuine love through the implementation of the knowledge acquired through this activity. Grant us your divine wisdom as we go about our daily task after this webinar. This we ask in Jesus' name, amen.
Amen. We all know that healthy vision plays an important role in our children's development. It provides an important source of information about the world around them, and undetected problems often will cause trouble with schoolwork. As our children get ready to head back to school, regular pediatric eye screening should be considered as part of our checklist. And now, I always have the pleasure to introduce our well-loved Department Chairman, Dr. Riz Gonzalez, for her welcome remarks. Dr. Good afternoon po.
Okay. Thank you, Jamie, and good morning.
Good morning,
Good
Doc.
morning. Uh, Unknown to our audience, Dr. Jamie Galang is miles away, and yet he is still our able and very responsible host for our webinar. We are on season 2, episode 5 for this year for the webinar. And we really chose this topic, the vision screening in children. Remember, our eyes are the windows to the world. And pediatricians have this great opportunity that at birth we see them first. And that is actually our first encounter. We see if they have two eyes. We see if their slants are normal. We see if their sizes of the eyeballs are normal. And even the distance between the eyes. And as they go for baby checkup, or even when they have stormy course in the nursery, we do check for their retina, for the red, orange, red reflex. That's how important vision is for children. And remember, it is actually one of the most important sense organs of children for them to see the world and communicate to the rest of the world. As they grow up, we just don't see how they respond. Just imagine a 1-month-old looking eye to you in the guard, and that's actually a wonderful moment. Much more so when they start to have their social smile, and at 4 months when they really track you and have that hearty laugh. Then we still watch if there is nystagmus or that abnormal eye movements, or the wobbly eye wherein there is a to and fro. So it's not just a matter of getting the weight and the height. We pediatricians look beyond that. And eye examination is actually important. As we go back to the normal face-to-face classes, it is but high time that we check the vision of our children. Many of our preschool and school children, and most especially the teens, have really spent so much time beyond the required 2 hours screen time. So, without further ado, I want to transfer again to Dr. Jamie Galang to introduce our moderator and then our speaker. Beforehand, I want to thank our pediatric ophthalmologist for granting us this opportunity to have this very important lecture with us. Thank you, Dr. Patricia.
Yes, thank you, Dr. So now let me proudly introduce our moderator for today. She earned her Doctor of Medicine degree at the UERMMC, and she completed her residency training in pediatrics at Our Lady of Lourdes Hospital. She is now a fellow of the Philippine Pediatric Society and an active consultant here in Qualimed Santa Rosa. Our dear parents, fellow doctors, friends, let's all give a warm welcome to Dr. Mona Lisa B. Kiachon. Good afternoon, Doctora.
Hi, Jamie. Good afternoon. Good evening and welcome everyone to another discussion of a timely and important but often forgotten topic when it comes to the health care of our children, which is vision screening. It's important, especially now as we start the school year. I am very proud to introduce our speaker for tonight, who is the pediatric ophthalmologist at Qualimed Hospital in Santa Rosa. Dr. Patricia Cabrera completed her Doctor of Medicine degree as magna cum laude at UST in 2008, and she did her postgraduate internship at UPPGH. After that, Dr. Cabrera did her clinical fellowship of pediatric ophthalmology and strabismus at UPPGH Department of Ophthalmology and Visual Science and became the chief resident in 2013. She did her postdoctoral research fellowship of ophthalmic genetics and visual function branch of NIH, or National Institutes of Health, National Eye Institute in Rockville, Maryland. Without further ado, let me introduce to you and let us welcome Dr. Patricia Cabrera.
Thank you, Dr. Mona, for that nice introduction. And thank you, Dr. Riz, for the wonderful intro to vision screening. I don't think I could have said it better myself. Let me just share my slide here. Okay. So, again, thank you to the Department of Pediatrics for inviting me to give a talk on vision screening in children. I apologize because my slide's not really sharp. I'll just try to share again. Okay, so I'm very happy to talk about this topic with you. So vision is the ability to see. It's also called eyesight. And good vision allows us to appreciate the beautiful world around us and enhances our experiences. If there was something wrong with our eyes, it will usually affect our eyesight. To people with eye problems, the world may seem a bit blurry, like in the periphery of this picture here, or even a little bit dark. Children, especially the youngest ones, may not be able to tell us that there is something wrong with their eyesight. And this is one of the reasons why screening is done. So today, my objective is to help you understand the when, the where, the what, who, how, and whys of vision screening. Before we dive into it, let's talk about Bruno. Bruno is a 6-year-old male. He enjoys reading books and watching TV, and he has no eye complaints. In school, their school has a vision screening program, which involves having children read from an eye chart, one eye at a time. So when it was Bruno's turn, he read from his right eye, and this is what he saw. So he saw all the letters on the eye chart. And then when he read from his left eye, he cannot see the smaller letters. When he read using both eyes, it was as if nothing was wrong. So the school teacher referred Bruno to an ophthalmologist for a complete eye exam. And Bruno was found to have an error of refraction in his left eye. So there are three things to remember from this. Eye problems may not be obvious. So not all children may be aware that they have an eye problem. Not all children will be able to communicate that there is something wrong. And sometimes there will be no signs of an eye. Sometimes there will be signs of an eye problem, and sometimes there will be none. Some problems will develop later on during childhood. But the most important is that if there is a problem detected, it is better to detect it early so that we could start treatment early. Why? Why is it important to start treatment early? Why can't we just give them glasses when they grow up? Why don't we just do surgery when they are older? This is because there is a sensitive period of vision development, which is between a few months old up to 7 years old. So during this time, the eye is very sensitive to insults. If there is an eye condition that will cause blurry vision during this time, the child could develop a lazy eye. This means that the brain ignores the vision from that blurry eye. And then you would have to initiate a treatment, early treatment within a certain period of time in order to correct this. So this is the flow chart for vision screening. Vision screening is essentially a quick test to assess the health of the eye, to detect poor vision or any eye problems that may compromise vision or even the life of the child in some cases. So if the child passes vision screening, he may be asked to return for a repeat vision screening yearly. But if a child fails vision screening or cannot cooperate with vision screening, then he may be referred for a complete eye examination. Sometimes this involves having to put eye drops or having to check the eye of a child through a special microscope. And then after the comprehensive eye exam, an assessment will be given and treatment can be started. So who performs vision screening? Pediatricians, general physicians, teachers, nurses, or barangay health workers can perform vision screening. And the comprehensive eye exam is done by ophthalmologists or pediatric ophthalmologists. So the difference is, in vision screening, it's not really important to give a diagnosis. But the important thing is to detect poor vision or factors causing it, and to select patients that should be referred for a comprehensive eye exam. Again, this is done by trained professionals, usually non-ophthalmologists. And then a comprehensive eye exam is intended to diagnose, to figure out what exactly is wrong and to initiate treatment. And this is what is done by ophthalmologists. Before we go into detail about vision screening, let's discuss the visual milestones of a child. So this is a rough depiction of what a child sees. Newborns cannot really see well, but between a newborn age to about 3 to 5 years old, their vision develops gradually. And by about 3 to 5 years old, their vision is the same as that of an adult. So If there are no eye problems, then a child would have 20/20 vision by age 3 or 5 years old. A newborn will be able to look at the eyes of the parent and maybe even copy some lip movements. So at this time, pediatricians or other vision screeners may be able to check visual acuity by evaluating if the baby responds to light, if the baby blinks in response to light. At 2 to 3 months old, a child will be very interested already in their hands and feet. At 5 to 6 months old, they will be able to grasp small objects. No? At this time, a pediatrician may be able to evaluate visual acuity by seeing if a child can track a small object. At 7 to 8, 10 months old, a child can recognize facial features and develops a social smile. At 12 to 14 months old, she'll be able to recognize herself in the mirror. 2 years old, they will start to scribble and draw. At 3 years old, they'll be able to copy shapes already. 4 to 6 years old, they'll be able to identify letters of the alphabet. So they'll usually start reading by this time. So again, these are the visual milestones. So in addition, at 1 to 2 years old, they are already able to focus at near and far. So earlier than this, children are only able to see near objects. At 3 years old, they can name colors also, and vision is almost nearing 20/20. Between 4 to 6 years old, they have a complete depth perception and they may be able to use scissors already. So how do we do vision screening? So a vision screener, or in our case, in our hospital, the pediatrician will ask for any history related to the eyes. Is there anything that the parent notices? Are there delayed visual milestones? And here are some signs that a child might have vision problems. One is squinting, or they will try to squint their eyes in order to see clearly. Headaches. Some children may turn their heads to the side like that. Eye deviation or misalignment. Frequent blinking may also be a sign of a vision problem. Eye rubbing, shaky eyes or nystagmus. If a child does not make eye contact or does not fixate on objects. Unusual eye movements or always looking at a certain direction. If a child does not reach for objects, or if there is delayed motor development. Then an external exam, it's just a scan of the eye and of the structures around the eye, such as the eyelids. And what will you be able to see with an external exam? Usually, the eye will appear normal, but in some cases, there may be lid drooping, like here. So a lid droop might be a risk factor for developing lazy eye because the vision may be obstructed. This one is an incomplete fusion of the eyelids. For the eyes, you might be able to see white opacity in the pupil. This picture is the first picture is of a congenital cataract. You might be able to see a very opaque or white hazy cornea. A second picture is a child with congenital glaucoma. This one, the third picture is a child with a hazy cornea. That's an example of a corneal dystrophy or a inherited problem of the cornea. So you may also check the red reflex. This is the reflection of the retina if you look at the eye through an ophthalmoscope. So if there is any opacity obstructing the pupil, you will see it as an irregular red reflex or an unequal red reflex between the two eyes. So in the first picture, we see something obstructing the red reflex. This is a cataract. And then in the second picture, we see a very asymmetric red reflex. This one is a child, the left eye of the child has a mass inside the eye. So this is a retinoblastoma. You also check eye alignment or eye movement. So most children have straight eyes, but about 1% might have misaligned eyes or strabismus. So the first picture, the eyes are outwardly deviated. And in the second picture, the eyes are inwardly deviated. Finally, visual acuity may be measured depending on the age. As I mentioned earlier, if you are evaluating a newborn, you can evaluate whether they blink in response to light. If you're evaluating a 6-month-old, you can check their ability to fixate on and follow an object. For 3 years and above, you can start evaluating their vision using a visual acuity chart. And then at about 1 year old, if you have the instrument or the photo screeners, you can do this for children 1 year old and above. So these are examples of visual acuity charts that you can use for 3 to 5 years old. Some of them may not be able to identify all the letters of the alphabet yet. So you can use symbols, standardized symbols, or the HOTV chart, which only has 4 letters. And for 5 years old and above, for those that already know their alphabet, you can use charts such as the ETDRS, which looks like this. There are also online visual acuity tests. One is available in this website, and there are also instructions on how to use it there. Instrument-based screening, it's a very quick way to screen for any eye problems. It will detect errors of refraction, it will detect misalignment, and it will detect so it will detect errors of refraction, misalignment, and any opacities in the pupil. So when do we do visual system screening? This is the proposed schedule in the Pediatric Eye Evaluation's preferred practice pattern. This is the time when you do visual screening. So you can do it anytime between newborn to 6 months old, between 6 to 12 months old, between 1 to 3 years old, 4 to 5 years old, and every 1 to 2 years after age 5. And these are the tests that are recommended to be done. So for all visits, an ocular history and a scan of the external eye, red reflex, and examination of the pupils are important. By about 6 months old, the alignment of the eye should be straight by then. Earlier than 6 months old, it's okay if the eye is slightly outward or inwardly deviated because alignment has not really matured from newborn to 6 months old. So they will start assessing for misalignment after 6 months. Instrument-based screening can be done starting at 1 year old. Whether the child can track an object can be started. You can start evaluating this at 6 months of age. And then using visual acuity charts can be started in as early as 3 years old. So in the presence of any apparent eye abnormality, or if there is failure to reach visual milestones, it's important to refer for a comprehensive eye exam. So for example, here, at birth, if the child does not blink to light, at 3 months, if the child does not follow objects, 4 to 6 months if there is abnormal eye alignment. And if there is, and these are the thresholds for visual acuity between 3 to 5 years old. So at 5 years old, if the vision acuity is worse than 20/30 in either eye, a referral for comprehensive eye exam is important. There is a National Vision Screening Act, Senate Bill number 1706, which requires vision screening for all kindergarten pupils in the Philippines. So these are children about 4 to 6 years old. There are no implementing rules yet for this bill, so we are still awaiting the rules. So the common vision problems in children include error of refraction, or in Tagalog, yung may grado, amblyopia or lazy eye, strabismus or misalignment, or yun yung mga nagbabanlag or nagduduling. And there are also others that I will mention. So error of refraction is blurred vision that can be corrected by glasses. So the eye is much like a camera in that the light has to be focused on the back of the eye as it enters, after it enters the eye. And if there was a problem in the front of the eye that makes it impossible for the light to focus on the back of the eye, or if the eyeball was too long or too short, then the image that the child will see will be blurry. So there are different types of error of refraction. There's myopia, or those who only see clearly at near, hyperopia, those who can only see clearly at far, and those with astigmatism, where the vision is distorted at all distances because of an abnormal curve of the front of the eye, or the cornea. So amblyopia or lazy eye occurs when there is a reversible or treatable condition that is causing blurry vision that is neglected. So some of the examples are cataract, error of refraction, and strabismus. So these three examples can all be treated. And if they are not treated within the age of 7, then it might lead to permanent vision deficit, or permanently poor vision. Again, lazy eye, it is easiest to treat before the age of 7. And this is also why the National Vision Screening Act recommends vision screening during kindergarten age, because this will allow us plenty of time to treat the child before amblyopia or before lazy eye becomes difficult to reverse. So again, visual demonstration of why amblyopia occurs. The brain basically, if there is a blurry image in one eye, the brain learns to ignore this signal from that eye, and the eye becomes lazy. So strabismus is another frequently referred condition to us, and it is misalignment of the eyes, so usually either inwardly deviated or outwardly deviated, like this. So in strabismus, there's, especially if the strabismus is permanent, there's always just one eye fixating on an object, and the deviated eye can become lazy. Other important conditions are these conditions that cause white pupil. Cataract, you can, in cataract, if the patient has a cataract, you will be able to see a white opacity in the pupil, similar to retinoblastoma. Retinoblastoma is important to detect early. It is cancer in the eye, and it can spread quickly and can even lead to death if not treated early. Other conditions that are associated with eye problems include prematurity, developmental delay, nystagmus. This is an eye condition that that can be associated with a neurologic condition. Family history of errors of refraction, because up to 80% has a genetic component. Genetic disorders, particularly Downs or Marfan's or neurofibromatosis, juvenile idiopathic arthritis, metabolic conditions, those with torch infections, craniofacial disorders, and diabetes. So these are just some of the conditions that may have eye problems. So as mentioned earlier by Dr. Riz, the poor vision can affect school performance, and it can cause delay in motor, language, and mental development. And it can affect a child's emotional and ability to form social connections. So in conclusion, we discussed that vision screening aims to detect reduced vision and to identify risk factors that threaten the eye and vision development. It is done by pediatricians, general practitioners, other specialists, teachers, nurses, barangay health workers, or other volunteers. And it is done not just once. Ideally, it should be done periodically throughout childhood to identify disorders early enough so that they can be treated effectively. And remember, some disorders don't appear until later in childhood. So all who fail screening and those who are unable to cooperate for screening should be referred for a complete eye exam. So we do all this because we don't want children to become needlessly vision impaired or needlessly blind. And no child should be left behind in school and in life because of a treatable eye condition. And I really thank all our pediatrician colleagues for referring your patients to us. So let's start with the frequently asked questions. Number one, is vision screening mandatory in all schools? And why doesn't my child's school have it? So once the National Vision Screening Act, once the implementing rules and guidelines of the National Vision Screening Act is finalized, then vision screening will become mandatory in all schools in the Philippines for kindergarten pupils. Right now, there are only some schools who have taken the initiative to perform vision screening. So another frequently asked question is, should we wait until my child is old enough to cooperate before we bring him for screening? So as we discussed earlier, you can even screen a newborn child because there are different ways of doing vision screening. So there is no need to wait for a child to be old enough to cooperate. And then another frequently asked question is, my child uses screens a lot, so should I bring him in for vision screening? Yes, absolutely. So there are 8 stages in life where it is recommended that children be brought in for a vision screening. So it starts during the newborn to 6-month-old period, and then approximately every year after that. So me and my spouse wear glasses. Is it possible that our child will also need to wear glasses? And of course, because we know that there is a genetic factor factor in errors of refraction, there is a possibility that children of parents with glasses will also need to wear glasses. And last, is it possible to correct a lazy eye? Yes, once treatment is started, usually if you start treatment early until about early teenage years, about 15 years old, that's the period where you can reverse lazy eye. So here are some of the references that I have. Thank you again so much for allowing me to give this talk.
Wow, thank you, Dr. Ara. Thank you for that very enlightening lecture. So I'm sure many of our audiences have questions. Let me start off by asking some questions that have been asked previously during our discussion. So one is blue light are blue light filtering glasses necessary or helpful?
Blue light filtering glasses are not necessary. Not they only filter about 20% of blue light that's coming from our devices. And in fact, actually, the blue light from our gadgets is really, really so low that it doesn't cause that much damage to our eyes. We should avoid light sources that are so bright, so intense that we cannot help but look away from them. So that's a sign that a light source is too strong. So again, it's not really important that you put a blue blocking filter in your glasses. But if you want to, then it's okay. The way to prevent, to minimize damage or possible damage from blue light is to decrease screen use. Doc.
Okay, thank you so much, Dr. Ara. I also read a while ago that it is not really the blue light, but the short distance of the screen from the eye. So the accommodation or the strain on the muscle of the eye is the one that's causing the problem. So it's important to rest the eyes periodically while reading or especially while using gadgets. Is that true?
Yes, doctor. So if we are yung near work, it causes a lot of problems if it is if it is done too much, kumbaga. So near work includes yung looking at your phones, reading from books, and working on your computer. So they can cause tiredness of the eyes, muscle problems, accommodation problems, and they can also cause dry eye, especially for screens and cell phones. So because we tend to blink less when we're on when we're on our devices, so it can really cause dry eye. So blue light itself, there are studies that blue light can damage the retina, but only at very high amounts. Very high amounts. And there's really no evidence that blue light from gadgets even approaches the levels that can damage the retina, the back of the eye. So that's why, as far as ophthalmologists are concerned, to avoid eye problems associated with near work, parang you just have to moderate. Parang you just have to take breaks. Mm-hmm. And blue light blocking glasses aren't that important and aren't really proven to prevent any of those problems.
Okay, so siguro we should remind the kids to take breaks every 20 minutes and look 20 feet away. Tama po ba? And blink 20 times daw to moisten the eyes. In 20-20-20 rule, is that possible?
Yes, Doctor. So the 20-20-20 rule is a good rule because it's easy to remember. So 20-20 every 20 minutes, you look 20 feet away and for 20 seconds. Yung blinking, blinking 20 times is not exactly part of the 20-20 rule, but it's a good practice to blink frequently and to blink completely. So minsan kasi yung mga iba, pag nagbi-blink, parang kalahati lang. So it's important so it's important to blink completely.
Okay. Okay, Dr. Thank you for that. Another question from Dr. Riz is headache a common complaint for error of refraction in preschool or school-age children?
So there are some students or some children that have high errors of refraction that haven't yet been corrected, and they can cause headaches because they're straining to see clearly, and this causes headaches. And the other question is yes, and some children with for example, they have unequal errors of refraction. One eye has a higher grade than the other. This can cause headaches because your eyes work so hard to see and to fuse the images that you see, that it gives the children a headache.
Okay, noted, Dr. Dr. Zoila Zablan, our pediatric nephrologist, is asking, what are the indications for LASIK? What is the age for adolescents that we can recommend the procedure?
Okay, thank you, Doc, for that question. So for LASIK is a corneal procedure that will allow you to be independent from glasses. Because it changes the shape of the eye, so the light will now focus on the retina or on the back of the eye. So as long as the eye is still growing, it's not good to do LASIK because if that eye is still growing, then LASIK is a permanent procedure. So you might need to wear glasses after it kasi nagbago na ulit yung grado kasi nagbago na yung shape ng mata. So LASIK is usually done pag stable na yung grado. So this is around age 18 or older.
Okay.
Definitely in the Philippines, I don't think there's anybody who does LASIK in adolescents. There are some in Canada and the US, but there are some training programs that actually discontinued it also for one reason or another. So it's some before there are some institutions who advocate LASIK or who promote LASIK for children who have developmental delay and who refuse to wear glasses.
Okay, but it makes sense to wait until they're physically and physiologically mature before you do a permanent procedure like that, Dr.
Yes, Doctora.
Okay, thank you for that. And another, Dr. Lisa has many questions. Number one is, can you emphasize to us and especially the parents, the screen time, the recommended screen time for children? And what is the recommended distance of screens from the person, like a TV, laptop, or iPad, from the child who is using it, if there is one?
Okay, thank you, Dr. Reeds, for that question. So the World Health Organization recommends that no screen time is given to children between 0 to 1 years old, about 1 hour for children between 1 to 3 years old, about about 2 hour, sorry, 0 to 1 years old, 0, 1 to 3 or 4, 1 hour, and then at around age 4, 2 hours. Older kids, older children, there's no really recommended screen time. Parang it's up to the parents' discretion, but definitely they should be advised to give the child plenty of breaks. So it shouldn't be continuous kasi yung continuous near work can cause, yun nga, as we mentioned earlier, dry eye, accommodation problems, etc. etc. So, ayun po.
Okay. So recently or in the past couple of years, the children had no choice but to use their gadgets for long periods of time. So yung breaks talaga are very important, Doktora.
Yes,
So,
Doctora.
another question po, for children with errors of refraction, how often should they follow up since their eyeballs are still growing? So I guess yung pag-check ng kung yung grade nag-i-increase or nagre-revert po ba yun if once they reach halimbawa a certain grade like 100 or 150, will that improve enough para bumaba yung grado?
Usually it's not doctor hindi siya depende sa kung anong grade. Parang walang limit. There's no limit. Usually, doc, what happens is from about newborn, children are naturally farsighted. Parang yung grade, actually, their world is at near, pero their grade is farsighted. Parang for a farsighted person. So, hyperopic. And then, as they grow older, hanggang age 7, it will increase. And then, after about age 7, they become nearsighted na. So, kasi pag humahaba na yung eyeball, yung grado nagiging nearsighted na yung grado. Parang ganun. So, in short, as long as the parang it depends on each child. There are children whose eyeballs progressively increase in length until adulthood. So these are children who keep getting more and more nearsighted, more and more myopic, -10, -15, -20 hanggang pagtanda nila. Pero there are some children whose eyes stop growing at around age 7. So, yun yung parang na-reach na nila yung adult size ng eye and hindi na masyadong nagbabago yung grado.
Okay. So, but for those children who are already wearing prescription glasses and they already have error of refraction, how often do you recommend should they follow up with their ophthalmologist or optometrist para to check the eyes if they need to change the lenses?
So, it depends on the age of the child. If the child is very young, for example, 1-year-old or 2 years old, the follow-up is a bit frequent because the eye rapidly changes during that age. But it slows down around 3 to 7 years old, so it slows down. So pwedeng yearly or twice a year during that time. And then definitely after 7, hindi na masyadong nag-change. So pwedeng every 1 to 2 years yung change ng glasses after that.
Okay. And I guess depende rin sa tinitreat, like yung mga may strabismus or lazy eye.
Doc.
Depende sa improvement from the past consult.
Yes, Doctora. So if there are other eye problems like strabismus or amblyopia or lazy eye, definitely that the follow-up schedule will change.
Okay po. So, Dr. Jamie Galang is asking, what are some examples of strong sources of blue light or light that is harmful for the eyes?
Okay. So, Doctor, there are some lasers that we use for example, for treating the eyes, or there are some dermal lasers rin that have been reported to cause some damage to the eye. Yeah, parang NDIAG yata, if I'm not mistaken. So, those are some, yung mga lasers, so kasi they're focused light, they can be harmful to the eyes. Pero the most light sources naman in our daily lives are okay. Some are concerned about yung mga LED, yung mga, what you call that, Doc? Yung ring lights, di ba? Opo, ring light or yung LED lights from mga headlights ng ibang car. So, yun naman, brief exposures from those will not really damage your retina right away. But they hurt our eyes usually. So, it's best not to look at them, not to look directly at them. The rule is if a source of light hurts your eyes too much that you can't really bear to look at it, don't look at it.
Yeah, that's true. So kahit na sunlight, if it's a very
Yes,
bright
Doc.
day, it doesn't just damage your eye, but by squinting, it will cause wrinkles eventually. So better protect your
That's
eye.
true.
Okay. So Dr. Reese is asking also, at what age do you recommend contact lenses? Is it recommended for children? Or who are the candidates for Dr. Zablan has already asked about LASIK. So I guess it's the contact lenses is the concern at this time.
So Doctor, the question is, what age do you recommend contacts?
If at all recommended.
Okay. Doctor, you can actually give contacts to newborns or to babies who are a few months old. So it's okay as long as the parents are confident in applying the contact lenses. And of course, as long as the proper precautions are done. So such as your hands must be clean, and you have to put the contact lens in solution, and you have to remove the contact lens at the end of the day. So there are precautions lang, but in general, even babies can wear contact lenses. There are some conditions where contact lenses are recommended over glasses. For example, pag sobrang magkalayo yung grade ng dalawang mata, it's better to wear contacts because it causes less confusion. Opo. It's easier to combine the images from the right and left eyes in some patients that have large differences if they wear contacts.
Okay.
But a lot of parents are very scared of it.
Oo, kasi children, of course, have to be responsible enough and mature enough to be careful in maintaining the cleanliness of their contact lenses. They have to make sure that they clean it every night, take it out every night, para they don't cause any infection.
Yes, Doctor. Yes, that's a concern of parents, but yeah.
Okay. Sige. Dr. Reese again is asking, do people with lighter eye color or iris color have higher risk for errors of refraction or early cataracts?
So yung lighter iris color, like mga Caucasian, Doc, no? Pagka for normal people who just have a lighter eye color, there's really, I don't think there's an increased risk for cataracts. It's just that they don't have pigment. But for those who have, for example, yung ocular albinism, kasi aside from their iris are light colored, maraming defects. Parang hindi siya kasing dense ng iris natin. So light can pass through easily. Tapos even the inside of their eye lacks pigment. So yung retina lacks pigment. And they are they are very sensitive to light. And so, ayun, they are advised to wear yung mga tinted glasses. But there are some conditions that parang there are some syndromes and there are some conditions that the signs for those are light-colored eyes. So may mga eye inflammation na isang sign is yung magkaiba yung kulay ng mata. So pwedeng sign siya ng inflammation ng eye or uveitis. Tapos may syndrome, yung Waardenburg syndrome. If lagi siyang feature sa GMA, yung mga, kita mo mga Pinoy na Pinoy yung itsura pero blue yung eye. So, usually sila, wala namang ibang problem. It's just that light blue yung light blue yung mata.
I've seen models, Dr. that have different eye colors in each eye. Parang merong black na model. Na iba yung left eye, iba yung right eye.
Yes, Doc. So,
Pero they have visual problems daw.
They have no visual problems, Doc.
Sabi.
Okay. Okay, Doc. So, genetics pa rin naman yung nagde-decide ng eye color. So, baka less lang yung pigment niya doon sa isang mata. So, yeah, it's possible.
And Dr. I think this is a very important question. In cases of trauma to the eyes, like accidents or foreign body, what is your recommendation or what are your recommendations for quick vision screening? Aside from checking yung mga bleeding around the eyes, yung mga eye area, is yung shining the light on the eyes enough, or yung reading would that be enough or sufficient to screen if there are deeper problems?
Okay, Doc. Yes, Doc. So, aside from examining the front of the eye, you can look for irregularities in the pupil. So, if there are irregularities in the pupil, baka pumasok na yung forehead body. You also look at the red reflex. So, if may bleeding po sa likod ng eye, you will be able to see a duller red reflex. Check for check for the aside from pupil size, check for an RAPD. Check if the pupil constricts to light or not. Tapos Doctora, yes, so of course definitely vision is your clue, no? If there are any deeper eye problems, absolutely vision will most likely be reduced po. So that's the best way to start to check the visions. Do a good exam. Tapos Doctora, if in doubt, it's okay to refer naman po to an ophthalmologist.
Okay. So
Doctor, an additional one po, if there's a metallic foreign body or a foreign body that enters either outside of the eye or the inside of the eye, what we usually ask for is we can ask for a skull APL, or to see if there are any fractures dun sa floor, we ask for a water's view. Like drinking water. So we can see the orbital rim. So those are the 3 x-rays that we request. Waters, skull APL. For metallic foreign bodies.
Okay. Waters and skull APL. So external exam of the eye for hemorrhages and obvious wounds or lesions, and then check the pupillary reflex, check equality of the pupils, and check vision. And then do, if necessary, if there's foreign object, do skull APL and Waters view X-ray.
Yes, Doc.
Okay, noted, Dr. So Dr. Galang is asking, how about the UV light used in gel nail polish or the light used by dentists for light cure tooth fillings? Are those safe?
So Doc, UV light naman po is, syempre it's really not advisable to look directly into UV sources. UV light can cause cataract earlier. If you're constantly exposed to UV light, you can develop cataracts earlier, and they can damage the back of the eye, the retina. So, but UV light is filtered by, kumbaga marami naman pong dadaanan yung UV light bago siya talaga makapasok sa mata. But it's still a good practice to limit your exposure to them. Or you wear, for example, one of the strongest sources of UV light is the sun. So when you go outside, it's better if you're spending time outside for a long period of time, wear polarized shades or mga glasses na may UV coat. Yun po. Or tsaka yung mga wide-brimmed hats.
Okay, so protection for the eyes and protection for the skin.
Yes, Doc.
So, Dr. how about the cosmetic or yung mga fashion colored lenses, or yung mga contact lenses that they use for yung mga teenagers or even yung mga even adults na they want to change the color of their eyes for aesthetic purposes. Are those safe?
So, Doctor, it depends on the brand. So it's better that if a child or if anyone is using contacts, it's better to buy the trusted brands. Kasi there are some the problem with some colored lenses is parang hindi reputable yung gumagawa sa kanila. And so we cannot really, sometimes they can cause eye infections, no? Hindi pala sila ganun ka-sterile. So it's better, no, if you want to use colored contacts for vanity, buy the trusted brands. Tapos don't share contact lenses with other people. Some kids, may mga bata talaga na ginagawa yun. But we also can remind them na, contact lenses can cause eye infections. So if you don't have, if you don't have a grade, if you're just wearing contacts para magbago yung color ng eye mo, you are putting yourself at risk. Parang ganun. Unnecessary risk. So
parang toothbrush no sharing.
yes.
It's safer not to order from Lazada or Shopee. Go to your ophthalmologist to buy the safe brands, the recommended brands.
Yes, Doctor.
Okay.
Optical shops.
Optical shops, yes.
Yes, Doctor.
And speaking of optical shops, Dr. Somebody's asking, what's the difference between an ophthalmologist and optometrist? Are they considered optometrists considered doctors? Can patients go to them for eye screening or for eye concerns?
Okay, that's a very, very good question, Doc. So optometrists, optometry is a college degree. Ophthalmology, it's a medical degree kasi it used to be part of EENT. Now it's just separated. So ophthalmologists have a medical degree. They studied medicine after college. Mga optometrists, they studied in college. So it's a course. It's a college course, yung optometry. So they are called doc then. They are called doc by their colleagues and by patients. They specialize in checking errors of refraction checking the grade of the eye, prescribing glasses, and they are the ones who make the glasses. So, yung gumagawa ng salamin.
Okay.
So, pagka meron pong ibang sakit yung bata or may ibang sakit sa mata, hindi sila actually allowed to treat it. So, doon talaga sila sa grado. Minsan, may mga there are optometrists who refer yung mga pediatric patients. They don't want to check the grades of pediatric patients kasi oftentimes we need to give eye drops to the children, and not all optometrists do that. Kaya they still refer to us, to ophthalmologists, for refraction of children.
Okay.
For adults, Doc, yes, Doc. So if you're for vision screening, definitely pwede naman po silang puntahan. Pwede silang magbigay ng salamin kung wala naman pong ibang problema sa mata. Pero pagka may mahanap silang ibang problema, nire-refer po nila sa ophtha.
Okay. Share ko lang. I think I would suggest, at least especially for the first screening, yung mga preschool and school-age children, I would highly recommend to see an ophthalmologist para if there are any other problems other than errors of refraction, they can be addressed already and diagnosed. Kasi if, like for me, for example, I was diagnosed with amblyopia just last year as an adult. So beyond the 7-year-old recommended or cut off na for amblyopia to be treated. So had I known, kasi before in high school, I was brought to optometrists for glasses, for fitting of eyeglasses. So if maybe there was a pediatric ophthalmologist who seen me that time, so I wouldn't have amblyopia until now. So that time I didn't have any known symptoms other than yung clumsiness. They called me lampa, so I often tripped. Kasi yung perception ng distance is different in each eye. So I think it would be highly recommended. I would highly suggest to my patients and all our audience to see an pediatric ophthalmologist, at least kahit initial screening para for diagnosis and complete check-up of the eyes.
Yes, Doctora, thank you for that. So definitely, if you go to an ophthalmologist, we will do a very complete eye exam. Lalo na pag pediatric ophthalmologists, we really try not to miss anything. Kasi it's very poor vision in children can impact their adult life also. So we really try not to miss anything. But then, of course, there are so many millions of children in the Philippines. So it's very hard for all of them to look for a pediatric ophthalmologist. That's why vision screening then, for example, if for the truly high risk, absolutely, first screening should be with a pediatric ophtha, for example, yes, Doctora. And pero there are some children who are parang usually they pass the vision screening. Probably, Doctora, when you were young, baka they didn't, there was no, hindi pa common, di ba, Doctora? When we were young pala, when we were younger, parang hindi siya ganun ka-common. So, tapos if it's not done periodically, kung once lang, hindi siya ginawa periodically, very likely to miss something. Kaya, very important to not just do one screening, but do it throughout the different stages of the child's development. So, that is one way to prevent to avoid missing an eye problem.
Yes, that's true. Kasi it also leads to accidents, to
yes, Doctora.
To difficulty in school.
Yes, Doc. Mm-mm.
Ayun. So thank you, Dr. Another question naman from Cheryl Ann. What are the usual red flag signs of vision that you encountered that needed further neurologic evaluation?
Can you repeat, Doctora? The
Um, what are the usual red flag signs of vision that you encountered that needed further neurologic evaluation?
So, Doctora, one sign could be nystagmus, yung shaky eye. So, that's one neurologic sign. Lalo na yung nystagmus that's not horizontal, lalo na yung vertical, yun yung mga can point to a neurologic sign. Tapos, Doctora, yung so, 'di ba, if there's increased eye pressure, one of the earliest nerves to be affected is cranial nerve 6. So some patients will have inward eye deviation because of a palsy in their cranial nerve 6. Yun po yung some of the signs. Also, pupils that are not reactive to light, those are important to check. What else? Ayun, an abnormal, syempre, abnormal neuro exam. And if you look at the disc, Doctora, indistinct disc borders could be a sign of, lalo na if both eyes have indistinct disc borders, that could be papilledema. So, I'm sure all our pedia neuros know how to evaluate the optic disc naman.
Okay.
Di ba? So if you don't if a screener doesn't do that, then it's okay to refer naman po, doc.
So I guess, Doctora, it also would matter if the condition is of a recent occurrence. So parang previously normal and then suddenly there's a change, there's an abnormality, or there's a history of trauma, and you notice a deviation or abnormal anatomy or abnormality in gaze. Siguro it would be best to refer to a neurologist for more thorough exam of.
Yes, Doctor. Definitely, you're correct. Yung mga acute kakayari lang na eye deviation, sometimes we refer to a pediatrician or request for a scan. Mm-hmm.
Also, if there are other symptoms like vomiting, mga systemic signs and symptoms that occur in relation to the eye problems, kasi there might be more in-depth or more systemic cause of the problem.
Yes, Doctor.
So, Doctor, this is a controversial question. So what do you do, or what do you advise parents who both have black or brown eyes, but whose baby has bluish or gray eyes? Different yung color ng baby than the parents.
Okay, Doc. What would I advise parents?
Yes.
Okay. So definitely you can advise them to have an eye exam, because first we have to determine if there's anything wrong with the eyes of the baby, or if it's just genetic. So kasi diba, Doktora, ang eye color, ang dominant is yung dark, yung brown. Pero so pagka meron kang recessive tsaka dominant na gene, tapos pati husband mo may recessive ka na gene for eye color, tapos yung baby mo nakuha niya yung parehong recessive, parehong non-pigmented na gene, which is recessive, pwede siyang hindi pigmented yung iris. So, pwede siyang, maybe it's just genetics, Doc. Kaya, better to have the eyes checked first kung may any problems before we say, we tell the parents that, oh, there's something wrong with their baby's adopted.
Buti ko adopted. Bago pagdadahan. So, pwede pala yun, Doktora, kung both sides merong lahi, like may foreign blood or Caucasian lineage on either side, they can have, it can appear in the offspring. Kahit
Yes, Doctora.
parents dominantly or predominantly dark-colored yung eyes.
Yes, Doctora.
Okay. And also, you mentioned before, Doctora, that yung iris color can darken pa as the child grows older.
Yes, Doctora. So sometimes there are newborn babies that seem to have very lightly colored irises. Pero kasi the pigment production in the iris increases as the babies grow older. So as they age, their normal babies, their irises will darken.
Okay, so well noted.
Yes, sorry. Unless, Doctora, they have conditions like albinism. So some patients with albinism will have light-colored irises forever.
But of course, in that case, hindi lang yung irises yung light-colored. So it would be very obvious na there's a different condition, not just with the eyes, talagang may genetic condition yung child.
Yes, Doctora. So, yes, some that have albinism will also have cutaneous, yung light-colored skin, light-colored hair. Pero some with ocular albinism will only have problems in their eyes. So, light-colored irises o kaya shaky eyes, ganun.
Okay. So, Dr. Galang is asking naman, would eye patch help patients with exotropia?
So, eye patching, Doc, is primarily for lazy eye kasi it's intended to train the eye with the poor vision to see, and it works for lazy eye. As long as you start treatment early enough. Definitely pag mga older than 17 na yung bata, hindi na masyadong effective yung eye patch sa lazy eye. For exotropia, the reason why it could work in exotropia is pagka malabo yung mata ng bata, pagka napalinaw mo yung mata ng bata na may exotropia, pwedeng mas kaya niya pong i-realign yung eye niya. So in some cases of exotropia, it works by improving vision and thereby stimulating fusion of the two eyes. Pero it doesn't work in all cases of exotropia. Lalo na pagka maganda naman yung vision nila or yung pagbabanlag nila ay constant na, hindi po siya nakakatulong to straighten the eye of the child.
In those cases, Doctora, or in cases of strabismus, is surgery recommended, and if so, at what age?
Yes, Doctora. So it depends on the type of strabismus. For exotropia, usually we recommend surgery before age 7. One is yun nga, because of lazy eye, the possibility of developing lazy eye, and to promote depth, para mag-develop sila ng depth perception.
Okay.
Earlier rather than later.
Okay. Another interesting question, Doctora, from Dr. Maravilla. What is the best reading position in relation to the light source? So I guess if the light source is in front or at the back.
Okay, Doc. So, I read somewhere, Doc, that the best light source would be something overhead. Kunwari, a reading lamp on top, or illuminating the front the monitor or your keyboard or your book. Tapos, yung room light din should be cool naman. A cool light. So, cool light sa room plus a warm light for your workstation. That's what I read. Tapos syempre it shouldn't you should avoid glare, Doc. Kasi yung glare can aggravate eye strain. So, if you're working in front of a window, pwedeng magkaroon ng glare from outside. Or if your table is shiny, pwedeng magkaroon ng glare. So, yun po yung mga pwede nating i-minimize na light sources. Yung window, tsaka yung glare from surfaces.
Okay. Dr. we have two last questions po. So the first one, or second to the last, is it really bad to read while you are in a car or moving vehicle? Or while
Doc, kasi some people have motion sickness, so reading in a vehicle can parang they cannot tolerate doing anything really in the car if they have motion sickness. But generally, it's not very common for ophthalmologists to advise against reading in a vehicle. It's not really that common for us to Yeah, I don't really think there's anything wrong, except baka madilim masyado.
Baka mahilo or madilim, yes.
Yes.
Kasi very common yun, doktora, pag nagka-cramming ka na, tapos magpasok ka sa school, di ba, nagbabasa ka pa.
Yes.
Okay, so last question, doktora, from one of our staff. If for kids na mataas na astigmatism, does it slow down or does it tataas pa rin? Will it still progress?
So astigmatism, no, it's a problem with the front of the eye, yung curve ng cornea, kaya ka nagkaka-astigmatism. So for babies, mga newborn up until mga 3 years old, pwedeng yung curve ng mata nila ay magbago pa while they age. So pwedeng magbago or mawala yung astigmatism nila. But if meron ka ng astigmatism at around age 7, most likely you'll have astigmatism until adulthood. And there are certain types of patients who even in adulthood, their astigmatism keeps on increasing. Those are people with keratoconus. So it's a thinning, no, weakening of the cornea, kaya pataas yung astigmatism nila. So that's why we carefully monitor children with very high astigmatism.
Okay. So corrective lenses lang po for that.
Yes, Doctor. For most cases of astigmatism, yes po. Glasses or contact lenses.
Oh, so contacts will work as well.
Yes, Doc.
Okay. So I think that's all the questions that we
Sorry,
have.
Doc.
Oh, yes,
Sorry,
po.
Doc. There's a question here. Sorry for interrupting you. There's a question from Dr. Sacro, a pedia neuro. Thank you for referring your patients, Doc. Where can I refer my patients daw for VER near Laguna? I don't know, Doc, if Qualimed has VER, but I know that okay lang po ba magsabi ng ibang hospital?
Sige po ako para alam po nila.
Okay lang. So VER po is available in Asian Hospital. I'm not sure if it's available in yung sa Calamba, yung 'di ba may eye hospital po in Calamba. I'm not sure if it's available there. But definitely it's VER is available in in Asian Hospital and most of the big hospitals in Metro Manila. Tapos usually yung sa Asian Hospital, they can do VER po in older children, mga after 1-year-old. Pag mga younger than 1, medyo mahirapan sila. Yeah, that's what as far as I know. Pero baka some pedia neuro have other know better.
So baka bibili na rin po ang Qualimed.
Yay.
Okay. So if there are no other questions, I don't see any on Facebook and in our chat box. So I think that's all the questions that we have. Doc, sorry, Dr. Gonzalez is raising a concern. Another common concern daw is bawal matulog ng basa ang buhok kasi baka mabulag. Can we clarify that?
Alam ko, Doc, pag matulog ka ng basa ng buhok, yung unan mo magkakaroon ng maninilaw. Pero sa mata po, wala naman po talagang problem kung matulog ka ng basa yung buhok.
Okay. So just to dispel the myth. One of the common myths. Okay, so I think that's all the questions that we have. Thank you for a very thorough and helpful discussion, Dr. I'm sure our audience learned a lot. Do you have any parting words, Dr.? Would you like to share with us your clinic schedule at Qualimed? Where do you practice? And please share your information with our parents who are watching now so they can come and visit you at the clinic in Qualimed.
So our clinic in Qualimed is in the room 106, no, and there's an ophthalmologist on duty almost every day. My schedule is every last Tuesday of the month, in the morning, 9 to 12 usually, in Qualimed. I also hold clinics in De La Salle, UMC, Asian Hospital. So those are my clinics in the South.
Okay, Dr. So every last Tuesday of the month, 9 to 12 at room 106, right across the Pedia Clinic.
Yes, Doc.
So well noted, Dr. So with that, I would like to end our discussion, our webinar, but I would like to give the virtual floor to Dr. Maravilla for her parting words.
Hi, Dr. Before Dr. Maravilla's closing message, would just like to thank you and Dr. Cabrera for that very interesting and thorough lecture and discussion. I hope with all those information, parents would now be encouraged to find time to have their children's eyes checked or screened. So now we would like to present our certificate of appreciation to Dr. Patricia E. Cabrera for her expertise and valuable role as speaker during the webinar entitled Vision Screening in Children, given this 28th day of June 2020 via Zoom virtual event. Signed by our Chief Operating Officer, Attorney Nirmala Barbara S. Vangarja, and Dr. Lilibet M. Maravilla, our Medical Director. Thank you, Dr.
Thank you.
And,
Thank
and
you
also we would
Pediatrics.
Yes, thank you, Dr. And also we'd like to give this certificate of appreciation to Dr. Mona Lisa B. for her expertise and valuable role as moderator during the webinar entitled Vision Screening in Children, also given this 28th day of June 2022 via Zoom virtual event, signed by Attorney Nirmala Barbara S. Vangarja, our Chief Operating Officer, and Dr. Lilibeth M. Maravilla, our Medical Director. Thank you again, Dr. Mona.
Thank you, Jamie.
Also, we'd like to thank everybody who attended and also our partners, Natra Farm and the Qualimed Santa Rosa team. So now, friends, even with her very busy schedule, we are always honored and thankful for our dear hospital director for always gracing our monthly webinar. Let's all welcome Dr. Lilibeth M. Maravilla for her closing message. Doktora, good evening po.
Hi, good evening. Good evening to the Department of Pediatric again. Nahit na naman ang Department of Pedia. Very interesting, Very interesting lectures. And then, more than just the lecture, mas interesting ang question and answer portion, Kasi ang daming interested talaga to know the details of the different diseases in the children's eyes. So tonight, just a short recap, we were able to really emphasize the importance of early recognition of the different diseases. And this is, of course, this is largely, or it will be contributed largely by parents who should be observing closely their children during their development. And of course, parents also who should be disciplining their children to make sure that the children adheres to what is recommended as they grow old or as they develop, because that can be protection to their eyes and to their body as a whole. And then very important, also stressed in this lecture, is periodic visits to our ophthalmologists, pediatric ophthalmologists. And this is very good as a primary prevention method to various diseases of the eyes. And that can, as Mona has emphasized, and as Doc Patricia has also give emphasis, all of this should not be missed out during childhood, especially the examination, the thorough examination, and the serial follow-up of children for their eye check, because this has a great impact when they grow old, as they perform in school or even at work. At yun nga, if the corrections are late, then there might be, or there is a great significant possibility that the abnormality may not anymore be corrected. So thank you very much. At ang interesting, very interesting, di ba? Ako, you used to read pocket books pag pagod na pagod ka na, di ba? Lying on your bed. Tapos sabi pala ni Doc Pat, bawal pala yon. There should be no glare sa mata. Pero yung ginagawa mo yung gabi-gabi. So very, very enlightening lecture. So thank you very much, and congratulations to the Department of Pediatrics, of course, headed by Dr. Reese Gonzalez, and our very beautiful ever MC, lagi na lang si Jamie, and then Mona for the great for moderating the lecture, the session. Very good moderator, and also, of course, to our speaker, Dr. Pat Cabrera, for that very excellent lecture. Back to you, James.
Thank you, Dr. Again, thank you everyone for attending our monthly parents webinar. We would also like again to invite everyone next month for our webinar entitled Weight Loss, Weight Gain, When Should We Worry? Our speaker will be our pediatric endocrinologist, Dr. Lulu Malabuyok, and the moderator will be Dr. Kat Dones. This will be on July 26, also at 6 p.m. We hope to see you again. So everybody is encouraged, as we see on the screen, if you want to have your vision, if you want to have your vision or your children's vision checked, you can go to Qualimed. We have this vision of the clinic there at the second floor for vision screening. Operating hours will be 9 to 6 p.m. Mondays to Saturdays. And also for diagnostics, we have Vision and Laser Center. Also operating at 8 a.m. to 5 p.m. Tuesdays to Saturdays. Hope to see you on, you can go there anytime and for your checkups. Thank you again and have a good night. Thank you for attending. See you next month.
Thank you. Good evening.
Thank you,
Thank you,
Jamie.
Po.
everyone. Across the Pacific pa yan si Jamie, ha?